It is nice to see you again, Westchester. It is Friday, July 25th, 2025, and I'm Benita Ties with the Westchester Chronicle. It has been 5 years since the COVID pandemic closed down our community. In this special report, our editor Kyle Hudson sat down with our former state representative Dianne Herrin, who was mayor of Westchester at the time, about her experience.
Hi, my name is Kyle Hudson from the Westchester Chronicle, and I am here with my friend, former mayor and former state representative Dianne Herrin. How are you, Dianne?
I'm doing great. How are you, Kyle?
I'm doing good.
Good.
So today, I want to talk to you about recent history. But you were the mayor when the COVID-19 pandemic hit. And so I was wondering if you could just share with us a little bit about what the experience was like, what it was like, being right there at the front lines of all of it. So I guess my first question would be, when did you first hear the term COVID-19?
Gosh, certainly don't remember, exactly where I was or anything. But I mean, just like everyone else, I think that I first read about it, as this occurrence elsewhere in China in particular. And this was, before it really became a big issue here. But with the rapidity with which this pandemic, became a global concern was pretty astounding, I think, to all of us and to me. Um, and then, as we know, it very quickly became a real issue for all of us in our daily lives for quite some time. So that's how I remember it.
So, but you're the mayor of Westchester. What were those first days like when the reports are coming in and now you have to start making decisions? What is the severity of this, right? What were those first? What was going through your head in those first couple days?
Well, I mean, the way I respond to everything is pretty similar, and that is that I decided I better really dig into this and try my best to understand it so that I know how to respond to it as effectively as possible. And that in and of itself was a real challenge because there was a lot that we just didn't know. I mean, nobody knew, and so um, it, there were different theories about how it was transmitted and, all kinds of different types of information. And also, different interpretations of how severe this was in terms of its potential health impacts. And so it was disconcerting to me as a mayor to feel that, we are facing something possibly very significant without really fully understanding it. So it was a concern to me. And then, what really it started to build because the Commonwealth of Pennsylvania put in some restrictions on businesses, as you well know. For example, you couldn't go in and get your hair cut anymore. You couldn't really feel safe for the most part going into a restaurant and ordering a meal. And, some of the restaurants, of course, couldn't offer that anyway. And so it became, on the community level in the borough of Westchester, the loudest voices by far were those of the business owners in town because they were very concerned about keeping their businesses operational and not having to shut down or shut down for good. And people started to get really on edge. So it became, for me, a challenge of trying to, number one, navigate through what do we know, what don't we know, what is the science, what do we have to do to protect the health of each other and this community. And also with Chester County Hospital, right around the corner, and actually partially in the borough, what do we have to do to support them? Because the reality was they had patients in the hallways with no beds, and they were inundated and overcrowded and very much stressed. So I was concerned about that as mayor as well. Like, how can we put all of these puzzle pieces together and do the right thing on the community level in the face of these increasing restrictions that were coming down on the borough and the businesses?
And so, and correct me if I'm wrong, but wasn't Westchester one of, if not the first town to shut down in the state of Pennsylvania? Um, what was that? How did you come to that decision? And what was the pushback on that like?
Well, we weren't the first town to shut down. I mean, we were following the same directive that everyone else in the Commonwealth had to follow, because the governor came out with a substantial number of restrictions, and we all had to follow them. It wasn't just the borough. So that's what raised the ire of some business folks, because they felt kind of victimized by this whole thing, and very concerned, about how they were going to keep their businesses running. What I think you might be thinking of is that into the kind of peak of the pandemic, I did, as mayor, issue an emergency declaration. I used my powers to institute a state of emergency to restrict gatherings of large group gatherings, because, like I said early on when we started this conversation, my first order of business was to research this, and I continued to do that as the pandemic became worse and worse. And what I started to see was, I would follow the Chester County health numbers, and what I started to see was that we had rates of COVID transmission and rates of illness in the borough that were spiking higher than any of the surrounding communities. And what I thought to myself was, it's because we have large gatherings in the community. And I felt, given, again, my concern about the hospital having the capacity it needed and the ability to treat people. I mean, people were dying at this point, people, especially with pre-existing medical conditions, that I felt a responsibility to take this a little step further and to say, we are not going to have large gatherings of more than 10 people in this borough under this state of emergency, because that was happening particularly down at the university campus. And I did it based on the numbers. We were spiking where other communities were not. So that's, I think, what you might be thinking of, is that we did take it a little extra step than most other communities for that reason.
And what was the pushback on that?
Well, the pushback was, there were some business owners who, frankly, they were very upset. And it's really interesting, because when you're in a leadership position, people don't necessarily understand what you're responsible for versus what another leader might be responsible for. And in this case, I'm speaking of the governor directly. Like, I started to be kind of the recipient of the frustration around the governor's policies. And I mean, I had certain folks in the community videotaping me and asking me, how could you do this? Why did you do this? And so it was definitely a stressful time. But I stood very strong. I was very clear about what I felt we needed to do, and that was to protect the health and the safety of the people in our community first and foremost. I mean, we were in the middle of a pandemic. It was killing people, and our hospital needed the support and help for us to try to manage the transmission of this virus again, so that they could have the capacity and not be so overwhelmed that they couldn't treat people. And, you know, I don't know what is more fundamental to being a leader than working to protect the health and safety of the people that you serve. So I was personally, and the borough hit with a lawsuit from residents who felt that this state of emergency that I declared was unconstitutional. So in response to that, I held a public hearing, and I invited the scientific experts from Chester County Hospital to provide witness testimony. And you know, I invited all residents to come and participate in the discussion, because I really wanted people to understand the rationale for this, to understand what we were up against, and to voice their concerns, because, you know, that always helps. It helps people to voice their concerns. And so that was one thing I did. Another thing I did was I started a task force to close the streets in the borough, which is actually still going on. I started this very large task force full of business members, the local chamber, some residents, to shut down the streets so that we could dine outside safely. Because by this time, as I followed the science, it became pretty clear to me that if you're outside, you're so much safer, because the air is circulating. The difference being inside, where you have this HVAC system that is mechanically recirculating the same air over and over and over again, greatly increases your risk of viral transmission. But when you're outside in the fresh air, if you maintain a safe distance from each other, you know, the risk goes so low that I thought to myself, this is a way to keep our businesses going. And I suggested that, like the women's clothing stores put sidewalk sales out when the restaurants were all operating, to keep everything going. And for the most part, this was not easy either, because businesses were, you know, especially the non-restaurant folks, were worried this would make things even worse for them, because the people wouldn't be able to drive their cars near the stores and park near the stores. And so there was a faction that was really against it. So I worked really hard. I had the police department involved in the planning process to plan this out. And it turned out to be, like, I think one of the best things Westchester's ever done. And I'm actually really proud of it. So
that kind of segues into the next question. So, like, after the initial, right, we now have the town is kind of in pandemic mode.
right.
You run for state representative. What was your involvement and your experience with the public safety measures that followed, right? Because you then elevated up to the state level, and
Right.
you had involvement up there too. So can you just that tail end of, you know, your experience in government during the pandemic, what was that experience like?
Well, that's a really great question, because this was a whole next level type of involvement. And the state reps were pretty much universally really uncertain about what to do, because there was a lot of controversy, and there was actually a lot of like capitulation within the Pennsylvania State Health Department. Like they were trying to navigate their way through this too without having full information at their disposal, and frankly erring on the side of safety, because when you're just a resident on the street, it's easy to say, well, what about my business? But when you're in a position of making decisions about people's health and their life and death decisions, frankly, you err on the side of safety. And that's what they were doing. But it was causing a lot of uprising from, the real estate folks were so upset because they couldn't show houses. The folks with the restaurateurs were really, really unhappy. Anyone with a service business like a hairdresser or a barber, very concerned. And so the reps were under an increasing amount of pressure from their constituents to tell Governor Wolf to stop it. He's killing us type thing. And so what we did was we, with the county of Chester and the state health department, had weekly phone calls to get updates on their policy decisions and the science coming out about COVID. But frankly, these phone calls were not very productive. A lot of the reps would weigh in with lots of complaints and concerns and questions that couldn't always be answered. And so I would leave these calls with a little bit of concern that we really didn't have the ammunition, so to speak, that from the state that we needed to answer all of our constituents' concerns. So once again, I resorted to doing all my own research and understanding the science really well so that I could respond to the concerns that, people were bringing to me.
So I guess, you've had 5 years to think about all the things that have happened.
Yeah.
Is there anything looking back that you would have done differently?
You would think I would come up with something, and usually I do. But in this case, I was really proud of the way I managed it. And with the clarity and consistency and direction I took, I didn't waver. And I feel like one of the things I'm really most proud of is the Gay Street Marketplace, which is still, people go out there and they enjoy it so much because there aren't cars. The restaurateurs love it. And it's been a boon for the community. And I'm just really proud of that. And I feel like it's healthier overall, flu season, whatever, to be sitting out there in the air and the night, and it's wonderful. So I can't really think of anything. I was also really proud of the fact that I pulled these experts together from the hospital and had them give this testimony, because it really lent authority and weight to what we were doing and validation. And, I had no regrets about this part of my service.
Well, is there anything else you'd like to say in closing?
I don't think so, other than I think that when I reflect on this, what this really teaches me is when you're in this position of leadership, I do remember it being very kind of lonely, because you have people who disagree with you rather vehemently. You have to have this internal compass, and you have to believe in your decisions. And in order to get to that point, you have to know what you're doing. You have to work really hard to understand the challenges that face you and why you're making the decisions you are. And that enables you to move forward with strength and determination and direction, and lead. And, you know, that's really what people want, even though they may not see it in the moment. But I think for the most part, I'm sure there's folks out there who will forever disagree with what I did. No doubt about it. But I think for the most part, people appreciated the leadership and the intent to ensure their safety while doing everything we could to keep the town economically viable during these really challenging times. And actually, one of our business owners who owns a restaurant on Gay Street made more money during COVID than ever because he had a reduced staff and he had some incredible marketing campaigns and he had cars lined up to get dinners delivered, you know, directly curbside. And he created those Fauci pouches, if you remember those little pouches of to-go cocktails. Everybody loved them. So, I mean, that's a businessman. And I kept telling everybody, look what he's doing. Like, this is how you do it, you know? So anyway, that's it.
Well, thank you so much for your time and thank you for your service to our community. You know, I can't believe it's been 5 years, honestly.
No, I can't either.
It simultaneously seems like forever ago and yesterday. So
yeah, it does, doesn't it? We'll see what comes next, right?
Yeah, well, what comes next? Yeah, well, we'll record that here at the Westchester Chronicle.
I'm sure you will.
All right. Thank you.
Thank you, Kyle. Bye.
Before we go, we want to remind you that tomorrow, the 26th, the Chester County History Center is throwing a ball to celebrate Lafayette's return to Chester County. 200 years ago, after visiting the fields of the Battle of Brandywine, the Marquis de Lafayette came to Westchester to celebrate, rest, and feast. And now you can do the same. The ball will take place at the Chester County History Center, located at 225 North High Street at 6 p.m. And you can purchase tickets at mycchc.org. So come on by to party like it's 1825. As always, we appreciate you tuning in. Thanks to your continued support, our team has grown and we look forward to bringing you even more coverage. With our friends at Alliance Space, we can take our project to the next level. However, in order to keep this show ad-free, we will need your help. If you appreciate what we do, please consider becoming a supporter on Patreon, liking and sharing us on Facebook, and subscribing on YouTube. It's the easiest way to support us and help us bring you the news. And if you'd like to listen to our show via podcast, you can find us on SoundCloud. Finally, if you have a news tip, an event you'd like us to cover, or just want to say hi, you can reach us via email at westchesterchronicle@gmail.com. We look forward to hearing from you. Our program is produced by Crimson Planet Media, recorded at Alliance Space here in downtown Westchester, and our music is by Doug Keller. As always, we want to thank you for your time, and we hope to see you soon. Until then, I'm Benita Ties with the Westchester Chronicle.